Good morning. I'm Jessica Lovell. Welcome to the Morning Medical Update. Women 40 and older need a mammogram, but the mammogram doesn't need to be a chore. Alexis Del Cid introduces us to a group of gal pals who are taking their health into their own hands and having some fun along the way.
We're going to go to Crate and Barrel.
I have some really great friends.
Cocktails at the Phoenix at 4, and then dinner at the Faux Frog at 5:30. We're coming from Manhattan, Kansas. It takes 2 hours to get here, and it's much more fun to do it as a group.
Everybody thumbs up. There we go.
These 6 women do nearly everything together.
We're planning on a Saturday brunch and sunfish sailing.
So an annual trip to Kansas City makes sense, but not for the reason you might think. It was a medical scare with one friend in the group that prompted this regular road trip to the University of Kansas Cancer Center.
I felt a lump on my breast, and I went to my local doctor, and it did seem to be questionable, so they ran some additional tests. They reported that I had a 1-centimeter tumor.
But before Barbara Gatewood started treatment, a friend suggested a second opinion. Advice she says saved her life.
Go to KU and get a second opinion. It's a premier.
We all know this group of gals because we talk about them and we love it. But yeah, I think we are seeing some groups of women that love to come together and get their mammograms as a group.
Why not? All right, let's start with Gina, Mike, and Allison. We just heard a little bit about Barbara, your friend Barbara. She got a second opinion here, but tell us a little bit more about this road trip idea. Who came up with this in the first place?
Well, I think that one thing that prompted it is that I had an unusual lab result on a biopsy that pointed to some kind of a rare disease. So I talked to my friend Loretta, who's always good about medical advice. She's a great person to consult, and I'd gone for a visit and asked to come back within 6 months and kind of delayed it. So Loretta was encouraging me to go with her. And so we just decided, let's make this a bigger trip. And before I knew it, Loretta had set up, I think, 6 slots at KU Med, and we all called in and got our appointments. So I think that's how it all got started.
So anyone can jump in on this, but were you getting mammograms regularly before this? Was there anybody who needed an extra nudge or a call to get in and get their annual mammograms?
I was getting them pretty regularly. I'd had breast cancer about 12 years ago, and so certainly after that. But even before, I was fortunate to have had it caught early.
Well, you are a 10-year cancer survivor. I want to make sure everyone knows that. We're so happy to hear that. So thank you for letting us share that. That's really good news. So question, go ahead, Micah, also.
I was getting regular mammograms, but I never anticipated that getting a mammogram could be associated with so much fun.
You didn't know it'd be this much fun. There's some horror stories about you coming in and getting
that was probably
screenings.
The case. Yes.
Yeah, go ahead,
That was
Gina.
probably the case where I was not getting them regularly, and probably wouldn't have. And this group of friends has prompted me to start doing this yearly. So I was helped by it.
Well, I'm just going to ask you that because you're not the only person who's needed to be reminded or maybe delayed getting those screenings. Can you tell us a little bit more about why?
You know, I don't know. I guess I never felt like there was a big reason, unless you had a big history of breast cancer, to start early getting mammograms. I didn't like going, so I just delayed. I would go more like every 2 or 5 years, but now I've started going every year.
We'd like to hear that. Dr. Winblad, jump in on that because you have women that are lagging behind, and we don't like to hear that. So talk to us a little bit about the importance of every single year.
You know, when we find cancers, we want to find them when they are the smallest, the most treatable. We want to have the best, likelihood of an outcome.
Or two later.
And reduce morbidity for the patient. So that means screening every year. That gives us the best chance of finding a cancer when it's small and most treatable.
So, Allison, I was going to ask you, do you notice anything different about getting your breast exams at KU Cancer Center versus other places? I guess the question is, why here? Why come all this way?
Well, I think especially after Barbara's experience, I felt that it was important to be screened at the place that, as you were saying earlier, the people who look at them look at breasts all day long and more likely to see and understand something if there is anything there.
So do you all feel closer because of this trip? What does it bring out in you? Kind of this girl friendship and bond? Give us a little insight into what this really does for you on a deeper level.
Well, I think we don't necessarily share every little medical detail with even our friends, and this way we're just close as women and closer in being supportive of each other, should anything happen. And certainly, when our friend Barbara went through her ordeal, it was, I think, important for all of us to be able to help her and as much as we could. So I think this kind of thing just increases that bond.
Absolutely. I think
there's that moment where, like whenever you have your screening and then an hour or two later, we all get
a... maybe in some new areas. Definitely, we always go to the Phoenix to celebrate, hopefully, clear results again. And just, the anticipation of getting together in a car, having a little brunch on the way, and then going through the mammogram process, and then having the whole afternoon and a little bit of the evening spent together. It's so exciting that the chore of getting mammogram done is just secondary.
Absolutely. Just a whole new meaning to staycation. Dr. Winblad, you are a dedicated breast imaging specialist, all breasts, all of the time for you. What's different does it make for a patient?
When you're a breast specialist and you've had dedicated training, specialty training, and that's your dedicated daily focus, you're going to become really good at your job. You're going to be an expert. And for patients, that means more accurate results. It means the best recommendations. It means that we're aware of all the most advanced technology and things that our patients may need. So it really makes an important difference for our patients when they come to KU. It really matters where you get your mammogram.
It does. They're not created equal. But then that begs the question, if you're somebody who can't get here, you can't drive the 2 hours. We don't want that to deter somebody from going somewhere else than us. But what questions then should they be asking? When do they know they need to seek further screening?
I recommend all patients, that are average risk. Once you turn 40, you should start getting a mammogram. And, I want you to get your mammogram most importantly. I'd love for you to come to KU, but ask the questions, look up on, now, we have the ability to search online and check out, the facility that we're going to be going to, check to see what kind of breast specialists work there or if they have good accreditation from the American College of Radiology. Those things are really important.
So one study showed that 42% of breast cancer patients that come to an NCI designated cancer center like ours for that second opinion, they get a better diagnosis and actually a change in some of their treatment. Why is that?
When you come to a comprehensive NCI designated cancer center like KU, you have access to all of the experts. All of the experts here are specialists in their field, and you have access to the best resources. So you're going to get the best interpretation by your radiologist. You're going to get the correct diagnosis by your breast pathologist, the most advanced surgical techniques. You're going to have access to the most clinical trials available, and even other resources such as our multidisciplinary tumor boards, where our specialists all provide opinions for patients. All of these factors truly have an enormous positive impact on our patients' cancer journey.
So we mentioned that mammograms are just one type of cancer screening. What are the others? When does an ultrasound make sense?
So for our patients who have a high risk of breast cancer, or for our patients who have dense breast tissue, they need more. So breast ultrasound is one option for patients who have dense breast tissue. For our patients who are high risk, we recommend they have a breast MRI every year in addition to their regular screening mammogram. So talk with your doctor.
Then we've got you in here.
We always do our best to get patients in. And now for dense breast screening, if you're coming in for your regular mammogram, you can schedule that with your ultrasound test or your MRI test as well. And I always recommend if patients are traveling a distance, the earlier you come in the day. If we need to add something on, far better to come earlier in the day because any additional test will require a physician order, which we'll have to obtain. So sometimes that can, lengthen our time to get someone in. So the earlier in the day, the better.
Well, it's perfect. That's what I'm saying. They can go grab lunch, go shopping, do all the things, and then they can come back if they need to. So I guess the big question for me is, how do I get in the group? So I want to ask, Gina, we'll start with you. Any advice for others listening that are maybe wanting to start their own mammogram girls road trip?
Yeah, just do it. Start early, because the earlier you start, the more likely that they'll have slots all together in the day. We found them to be very efficient. We've showed up thinking we're going to have to wait around for 15, 20, 30 minutes, for other people to go. But both times we've gone, they've just put us in one after another. And we've even in one of the centers, we waited in a big, nice waiting room together, which was kind of fun. They wouldn't allow us to bring cocktails in, too bad, but, we talked about it.
I know. I remember you talking about it, and I did make a call. And I was like, I think I know the answer to this question, but I appreciate you trying. Yeah. That was a good effort. Micah, just any advice for somebody wanting to reach out and maybe, nudge their friends to get together and go do this?
Well, I think it's such a nice idea, and just to have maybe even one friend to go together and plan something fun around it. Because going for a mammogram, it's never exciting moment to look forward to. But when you do it with your friend and you plan one or two activities around it, it just makes so much something to look forward to.
Yeah, Allison, you all have set the bar pretty high. So I like what Micah said. Just grab one friend and go in there in that sisterhood and look out for each other. So if you can make a big group, great. But what advice do you have for people wanting to reach out and do something like this?
Well, I think as I said, that getting the scheduler to understand that there's going to be a group, and then quickly having the other friends call in to get a time. I think that was the way that we ended up doing it, and it was very efficient and KU was very accommodating that way.
Love it. Well, if you have any questions, be sure to get those in on YouTube or Facebook. You can tweet us or email the Medical News Network. Info is right there on your screen. Let's get a check of our COVID count from Dr. Dana Hawkinson, Medical Director of Infection Prevention and Control. Happy Monday. How are you doing?
Happy Monday. Unfortunately, the numbers aren't as good as they were last week. We had 14 active patients last week, 20 active patients this week, so numbers have...
And Jeremy wants to know, Dr. Wimblad, can the level of breast density change over time or develop into dense breasts where maybe that wasn't there initially?
So absolutely, breast density can change over time. Typically, as we get older, our breasts become less dense, but that's not always the case. Breasts can also increase in density with things like hormone replacement therapy or weight loss. So your breast density can absolutely change. At KU, when you receive your mammogram, we do notify patients of their breast density. If you have dense breast tissue, we will alert you to that.
And that's part of the guidelines.
Absolutely.
But we've been doing that.
Absolutely.
So Terry has a question. If you get your mammogram in Kansas City like these ladies and their friends did, but then you do have to get additional screening, do they have to come back here, or is there a place out where they live that they can get those tests and then have those results sent back in?
So my recommendation, if you're coming from a distance, as I mentioned earlier, come earlier in the day. It's rare to need to be called back. About less than 10% of patients have to be called back for additional imaging, but when you do, we'll need to get a physician order. So alert the technologist when you have your mammogram if you're traveling from a distance. Come early in the day if possible. That way, if you happen to need additional imaging, we can do our best to get that physician order and get that added on for you while you're here.
Gina, a question for you. I'll let you answer for everyone, but about how long was it taking for you all to get the results from your mammogram? I guess those results were trickling in.
Yeah, I don't know. It was within an hour or two, I believe. We'd gone straight to Crate and Barrel, and there in Crate and Barrel, we got results back.
Love that. I have a question for all three of you. Do any of you remember your first mammogram, and have you noticed changes in the experience since then? Cindy would like to know. We'll start with you, Allison. Do you remember your first, and what's changed since then?
I don't honestly remember my first, but I think I certainly am more comfortable, and I agree with Gina. I think that the technician at KU Med just made it very relaxed, and the different angles were easy to get into position for. So yeah, I think it there's not an enormous change, but just slight changes to make it more comfortable.
Micah, do you remember what it was like when you went in for your first mammogram? Maybe what your feelings were like, or just what that experience was like?
Well, Lila, I do. Many years ago, I do, and I echo Alison's comments because it's. I remember slightly uncomfortable, maybe even a little painful. All this squeezing, but the last, I would say, 10 years, it's almost a comfortable procedure. And I never experienced any discomfort. So I think this is a big difference. Maybe a degree of comfort is higher, but nevertheless, I wouldn't say it's almost pleasant experience, but not unpleasant as it used to be.
Right. Well, that's good. Gina, what do you remember? That. All right, Allison, wrap us up. What's the big takeaway from your story?
Well, I agree with them. I think when we look forward to it, it makes the whole thing more fun. And maybe there could be other kinds of tests that other people could follow this model and start a trend. I think that's a great idea.
I know. Maybe one day they'll let you have champagne in there. We'll keep working on that, okay? Making it better. Okay. So, Dr. Winblad, what do you want the big takeaway to be? We've been talking about breast cancer stories and screening and treatments this whole month, but with this particular story and this group of ladies, what do you really want people to take away from it?
I love this story of friendship, and we could all use support and accountability like this. Early detection of cancer is crucial, and if you can be accountable to your friends and make sure they come and get their screening mammograms, I think that's wonderful. So if you're 40 years or older, please come and get your mammogram with a friend if you're able, and make it more fun.
All right. We'll see you next week to talk more about dense breasts. Thank you, Dr. Winblad. Thank you so much. A special episode of the Morning Medical Update dedicated to breast cancer will air tomorrow on KCTV5 and WIBW. Here's a preview. Coming up next week.
I just was taking a shower, washing, and then I felt a lump.
Breast cancer, from diagnosis to treatment and beyond.
So many people keep telling me how strong I am, and it's not that I'm trying to be strong. It's just I have 4 kids that need me.
Since the moment I was diagnosed, I wanted to get this thing out of me.
Specialized doctors working together, improving the odds of survival.
Someone you love will live because of this cancer center.
Cancer, Choices, Hope, and Science airs tomorrow at 9:30 a.m. here in Kansas City on KCTV5 and in the Topeka area at 9:30 a.m. on WIBW. Thanks again to all of our guests, and thank you to our viewers for being with us today. We'll see you back here tomorrow at 8. Coming up tomorrow on the Morning Medical Update. Breast cancer surgery saves lives, but it can also throw off your entire lymphatic system. I'm Jessica Lovell on the next Morning Medical Update. See the special techniques that can stop lymphedema before it starts, and why only specifically trained surgeons can pull this off. Tuesday at 8.
Subscribe to our Morning Medical Update and Open Mics with Dr. Stites podcasts. Now, everywhere podcasts are available.